Welcome to Webisode 3 on exception requests. I'm Eric Morse, an addiction psychiatrist who has over 18 years of experience working in opioid treatment programs. CSAT extranet exception requests need to be filled out for the following 5 circumstances. Number 1, special take-homes. This is when the patient has not earned them using the 8-point criteria described in Webisode 2, but the medical director feels the medical benefits outweigh the risks. Number 2, accelerated buprenorphine take-home protocol in North Carolina. Number 3, split dosing. Number 4, when you want to admit a patient that does not meet the 1-year criteria of opioid use disorder or is under the age of 18. And number 5, telemedicine admissions. Now let's start with special take-homes. Special take-homes may be for vacations that have some recovery benefit, for example, to attend an NA conference. Family emergency like a funeral or to see a dying relative, to attend a medical procedure that starts early in the morning and will last beyond dosing hours, or to attend job training. In the exception request, information that should be included for the state and feds to approve should include data on length of treatment compliance, stability of their dose, how many take-homes are required, and their dates, at least the last 3 drug test results, the date of their last 3 counseling sessions, the date of the last time they saw a medical provider, recent CSRS query results, the reason why the guest dosing is not an option, and any other pertinent information to explain why the patient should be permitted special take-homes. Missing information can lead to rejection and resubmissions, so it's recommended to give as much detail as possible. OTPs cannot give these special take-homes until they're approved by the system. It is recommended that they are printed and scanned into the medical record in case the chart is reviewed. Exception requests must also be made in the system every time we attempt to give buprenorphine take-homes faster than the federal regulations in 42 CFR 8.12. In 2010, medical directors compromised on an accelerated buprenorphine take-home protocol that allows for 4 take-homes after at least 7 continuous program compliance days in the OTP. With this protocol, the patients must have an illicit-free drug test result and meet the other 8-point criteria of stability. After 60 days of continuous program compliance days in the OTP and at least a second illicit-free drug test, the patient could be eligible for 6 take-homes. After another 60 days of continuous program compliance in the OTP and more illicit drug-free tests, the patient could be eligible for 13 take-homes. After another 60 days of continuous program compliance in the OTP and illicit-free drug tests, the patient could be eligible for 20 take-homes. After another 60 days of continuous program compliance in the OTP and illicit-free drug tests, the patient could be eligible for 27 take-homes. So what would take a methadone patient 4 years to achieve in terms of earned take-homes, a buprenorphine patient might take 240 days. It is important to remember that each time you plan to increase the take-homes, another exception request must be submitted. Exception requests must also be submitted and approved prior to splitting a patient's dose of methadone or buprenorphine. For methadone, all the data that you would need for a special take-home should be included, plus the nanogram per milliliter of their peak and trough levels. Webisode 4 on split dosing explains this process in more detail. In the event that you have a patient who does not meet the 1-year criteria in 42.8.12 of opioid use disorder, it is only 6 months according to the DSM-5, or is under the age of 18, you will need to submit an exception request, and it must be approved prior to dosing the patient. Evidence to include to help it get approved would be the amount and frequency of use, failed attempts at treatment, like OBOT, overdose history, and possible reversals with Narcan, pregnancy, and any other pertinent medical information. For patients under 18, you will need to provide parental consent with your request. Telemedicine admissions may be an option for emergency situations when the medical provider who usually works in the OTP is away. The medical director of the OTP feels that a telemedicine admission is necessary and a physical exam was performed by another qualified healthcare professional. Before dosing the patient, an exception request must be approved. Information in the exception request should include severity of use with drug test results, severity of withdrawal, and when the patient will be evaluated in person in follow-up. Comments on stability medically, with vital signs, and why the benefits outweigh the risks. A separate exception request needs to be submitted with each individual patient. A few additional tips about exception requests. Do not use the exception request to make your soda or CSAT bad guy. You should not say to a patient, "I would have given you those special take-homes, but the state or the feds wouldn't allow it." Do not submit incomplete exception requests. If you know the submission is lacking, save it in the system and ask your team to get it right. You can sign and submit it after it is corrected. If you are not sure you want to approve it, don't approve it. Talk to the patient. Talk to your staff. It is your medical decision. Don't punt it to anyone else. If you have further questions, please feel free to contact your state opioid treatment authority. Thank you for watching, and keep up the good work.